Healthcare has been behind.
Complicated.
Intimidating.
Complex.
Inherently unsafe.
A lot of different parts, and they're all interacting.
The dogma.
I'm the physician. I get to decide.
People are very afraid to raise a concern.
This is not because people don't care.
We weren't organized to change.
The vision of Cincinnati Children is to be the leader in improving child health. Innovation with ultimately a focus on the children is what it's all about.
We have to make better observations, to think more carefully, to ask what is it the patient and family is saying.
The Anderson Center really has been at the nexus of all of that. They have provided the encouragement, the skills training, the framework and methodology to help spread both here and around the world our progress on improving and growing.
So reliability is a core part of this. Patient-centeredness is a core part of it. Safety as a system property is a core part of it.
This is a place that is relentless in wanting to get better.
So how do you get people to believe that things are not great? And how do you do it in a way that doesn't let them escape from the truth? We do it by stories and we do it by real data.
If you're going to be about health, if you're going to be about best outcomes, so much of that really happens outside the walls.
Even though for many kids we know what the right thing to do is, getting it to happen in practice is very difficult.
The first thing we did was to say, okay, let's put parents on our teams. Now it's scary, you know, parents sitting at the table.
A parent is a vital part of that team because they're the ones who have to take this child home.
Health production is shared work.
All of us have to learn our way into a new system.
So how do we make the system work so that what everybody agrees we want to have happen, happens?
Modeling is a very important part of this process, talking about it.
Stopping in the face of uncertainty, asking clarifying questions.
Asking questions in a way that people have to answer, not a yes-no answer, but what could go wrong today? What are you worried about today?
It's the whole team wanting to work together, the doctors working with the nurses and the families.
If we didn't start working together, the changes were going to come too slow.
This is a place where if you have a good idea, how much you can accomplish is usually limited by how much energy you have. For me, it was I had this idea for this asthma innovation lab. We were going to try stuff out. You can do things here that are harder to do other places.
We now have the tools and the support to go and fix things in the system that people have been griping about for decades.
Where I've seen the biggest change is in the operating room. Historically, operating rooms have a very steep hierarchy. Even the last generation, nurses were trained, don't you dare speak to the physician.
You couldn't count the amount of times that we've had our nurses in the room that have raised important and critical questions.
At the front line, there can be no hierarchy. The person who is the newest on the job needs to be comfortable in speaking up. We expect them to speak up.
It's liberating. There's so much that can be done.
Some of the time I feel very much like an inventor. We're starting something totally new.
Bravely banding together to do what it takes to take care of the whole community.
The improvements that need to be made are yet ahead of us.
Part of being a pediatrician is a sense of hopefulness and importance of the future.
When I'm doing improvement work, it really is rewarding. I'm impacting dozens, hundreds, even thousands of kids and families. I may not meet them, but nothing beats taking care of a little kid.